What's another pre-op consideration? So there's times where I think certain patients are more likely to prematurely loosen or break that suture. I think many of you guys would agree that young dog that has a higher athletic drive is probably going to put that suture through a little bit more work than some of our other more sedentary patients. And so these cases are ones which I'm nervous, again, going with an extracapsular suture for these types of dogs. And it kind of stands to reason, and it's a bit counterintuitive. You know, a lot of owners would look at the extracapsular surgery and then a TPLO and be like, TPLO seems way more risky and way more invasive. And yet, if I handed them an X-cap suture and I handed them a TPLO plate and I told them to go away and play with those two things and break one of them, guess which one they'd have more success with breaking? I would bet many people could break that X-cap suture within a pretty short amount of time. I'd like to see somebody break a TPLO plate without use of some pretty fancy tools. So, you know, it sort of is a bit, again, counterintuitive to some owners about the reasoning behind our fears with premature loosening or breakage of the suture. The other category of patient which I think are potentially at risk for premature suture loosening or breakage are those pets that have the higher than average tibial plateau angle. And for this reason, if I'm doing an extracapsular stabilization, even if my patient checks all the other boxes to say, yes, they're a success, should be a successful candidate for extracapsular repair, but I still would actually want to do stifle radiographs and then measure their tibial plateau angle. The reason that I do recommend that now is because we know that dogs that have a steeper tibial plateau angle, and anything that is over 30 degrees, I would say I start to feel a little nervous about, would maybe placing that suture at a little bit more stress. And again, it kind of makes sense. We know these dogs are at risk of rupturing their cranial cruciate ligament at an earlier age because of that increased steepness to the plateau angle. And subsequently, I feel like that suture is also going to be under a little extra risk as well. And we can't make the assumption anymore that just because it's a small breed dog that checks all the boxes, that again, it will be fine. Some more recent studies have shown that actually there are some small breed dogs like Westies that can actually have a higher than average tibial plateau angle. The other issue I have with dogs that have the high tibial plateau angle is that mechanically, when you do have a high plateau angle, the mechanics behind where you place the attachment points for the X-cap suture become much, much more critical. This is an example of a small dog that actually had a type of an X-cap suture. It had a medial patella luxation repair actually combined with a tightrope procedure, which is kind of a variation of the X-cap essentially. And you may note that this dog actually does have a relatively steep tibial plateau angle. And with the placement of the tightrope anchor points on the femur and the tibia, that unfortunately caused the stifle to kind of be compressed into extension, with the tibia actually permanently somewhat subluxated forward following placement of that suture. So it becomes a lot more critical, and I would say more challenging, to provide ideal stability without turning that stabilizing force into a compressive force across the joint, holding it actually in somewhat of an abnormal position. So I'm talking a lot about tibial plateau angle, so I thought I'd briefly cover how to measure a tibial plateau angle. So we want to take a radiograph, a lateral stifle radiograph, centered on the stifle, but including all of the stifle joint and also the tarsal joint as well. Then we're going to draw a vertical line, which is actually what we call the mechanical or the functional axis of the tibia. And that denotates the center of the weight-bearing surface on either side, which you can see here in blue. And then we draw a line across our tibial plateau, which is essentially just the weight-bearing surface of that bone. So there's my tibial plateau line. And you would think that the tibial plateau angle is simply the angle between these two lines. It's almost that simple, but the tibial plateau angle is actually the angle between a perpendicular to our mechanical axis and the tibial plateau angle itself. In this case, happens to be 19 degrees in this particular example. So the average angle is 25 to 30 degrees in most medium to large breed dogs, and excessive TPA is considered anything over about 35 degrees. And so again, anything over 30 degrees, I do start to feel a little bit nervous about doing extracapsular stabilization on, and certainly for anything that is classified as excessive, I would steer clear of an XCAP in those instances. So the other thing that makes me worry about premature suture loosening or breakage is if this patient has either orthopedic or medical comorbidities. If, for instance, this dog has a cranial cruciate tear on the opposite leg, maybe it has hip dysplasia, maybe it has elbow dysplasia, reasons that this operative leg is going to have to take more of that mechanical stress in the recovery period from an early time, I actually would prefer not to go with an XCAP for multiple reasons. One, the recovery to or return to comfortable function in that leg is actually going to take a whole lot longer for an extracapsular repair than a TPLO. I know it doesn't make a lot of sense. It seems counterintuitive. Again, the TPLO in many people's brains seems a lot more invasive. And yet, what we do know is that tibial osteotomies like the TPLO tend to get back and start comfortably walking on that leg much, much more rapidly than what we see with extracapsular stabilization. So from an orthopedic, standpoint, that would be ideal if this leg could be utilized a lot sooner than later for all these other orthopedic problems. Also, that happens to take less stress off the surgical or the other legs as well when we have other orthopedic comorbidities. From a medical standpoint, say I have a dog that has an endocrinopathy like Cushing's disease, or another reason that they have poorer healing potential or slower healing potential. In those instances, I'm also nervous about the extracapsular stabilization because will their body truly be able to lay down the collagen in a timely fashion to help support the repair? Because if they aren't able to do that, then again, that suture is likely going to be at risk for failure.